One of the fastest and most exciting areas of plastic surgery that has changed in recent years is the area of injectable fillers. Now, I'm sure everyone has heard of different things like collagen and Botox, but really the questions we hear as plastic surgeons are, well, can I use Botox here or collagen here? Where do they all fit in? Now, there's many different classes of fillers that we discuss, and I'm going to share them with you today. The first one is a filler or an injectable that relaxes the muscle that's causing the wrinkle. That is the realm of Botox. Then we walk into class 2, or the secondary class, which is fillers. Fill the wrinkle in from behind. These include collagen, Restylane, Juvederm, Perlane, Radius, Artefill. All of these really plump the wrinkle up from behind. And then finally, there is a third class. This is a class where you inject the material, your body absorbs it, and then grows collagen where you put it. This is the realm of Sculptra. Now, all three of these do different things, but they can really be put together into a complete sort of facial rejuvenation package to really make a nice change for your face. So, first one we'll talk about is Botox. What is Botox? Botox, again, is a substance that blocks the nerve transmission to the muscle exactly and accurately where you put it. That effect lasts anywhere from 3 to 4 months, and primarily we use it in several areas on the face, between the eyebrows, the frown lines, the forehead lines of the forehead, and the crow's feet out here. That effect works beautifully for about 4 months, and you will stay smooth in those areas. Then the second class is really the fillers, where if you have a wrinkle in here, the laugh lines, want to plump up the lips, maybe a deepened furrow in your forehead area, you can push that wrinkle out from behind. So the first one we'll talk about is collagen. Everyone's heard about collagen in the past. It's been around for many, many, many years, has a great safety record, but the drawback to collagen was its longevity. It never really had the longevity compared to the newer fillers. Last anywhere from 2 to 3 months, and now, quite frankly, we have fillers that last 3 times that. So really the usage of that has dropped off pretty precipitously in the recent years. The next one we'll talk about is Restylane, Juvederm. These are the class called hyaluronic acids. Now you may ask yourself, what in the world is that? That is a naturally occurring biologic sugar which is found in our bodies as we speak. It fills our eyes, it's in our joints, it gives our skin its thickness in the face and throughout the entire body. So what was done is, it was taken, purified, put into an injectable form, and we replace it right where it's been lost in the creases. The advantages to these are that they're very easy to put in. They're injectable. It's a 20-minute office visit. They last anywhere now, we're looking at 4 to 6 months with a hyaluronic acid filler. And Perlane, one of the newest versions of hyaluronic acid, lasts anywhere from 6 to 8 months. So now we've jumped in longevity from 2 to 3 months to 6 to 8 months. So this is really a nice leap in our injection technology. People always ask, oh gosh, that must really hurt. How do you inject this into the lips? Well, here at Premier Image, we actually do it with a block. We do a little light lidocaine blocks around these areas so the entire face is numb and you are comfortable without any pain while we're administering the injectables. And then finally, the last class. We talked about the injectable where you place it into the tissues, your body absorbs it, and then grows collagen. This is the realm of Sculptra. Now, what is Sculptra? The material itself, the technical name for it, is poly-L-lactic acid. This is a material that has been used in surgical suture for decades. I use it myself in every facelift that we do. So it's a material that we're very accustomed to using and very comfortable with using, and we know the safety of it. What we have found is, if this is put into the tissues, wherever you place it, the body will absorb it and grow its own collagen. So it's a collagen neogenesis stimulant. So it really works nice for people that have sort of the facial lipoatrophy is what it's called. Thinning of the cheeks, hollowing of the temporal areas. You can really volumize these entire areas. Now I know this sounds great, so what are the drawbacks to that? Well, it's not immediate. You've got to grow your own collagen, so the effect can take anywhere from 4 to 6 weeks after each treatment. Notice how I said each treatment. There are several treatments involved, anywhere from 3 to 5 treatments over a time period to really achieve the volumization of what you want in the face. Now, once you achieve that volume that you're looking for, that will last anywhere from 2 to 3 plus years because it's your own tissue in those areas. And that really rounds out a good summary of the modern fillers that we have.